Non-communicable diseases will be something that we're discussing in the Spotlight this morning with the help of Dr. Maria Clapperton, the Director of the Non-Communicable Diseases Unit at the Ministry of Health. Good morning, Dr. Clapperton, and welcome back.
Good morning. Thank you for having me.
An important conversation to have, so we thought, why not have the authorities join us? And in this case, we wonder during the season of food and festivities, when we might get distracted from our usual routine, do we see during this holiday season an increase in the complications with non-communicable diseases?
Usually it's immediately after. So everyone's enjoying themselves for Christmas, probably a little too much and neglecting their health. And then come January, they tend to feel the consequences where, persons end up in the accident and emergencies. And we see an increase in the number of persons attending accident and emergency departments just after the holiday season. Persons with very high blood pressures, very high blood sugars, and complications from their chronic conditions.
Right. Things we could actually avoid.
Exactly.
And hopefully from this conversation, we will figure out how to. But in terms of explaining the groups that are most vulnerable to NCDs, are there any trends or shifts in the demographics most affected over the years as well?
Generally, persons afflicted with non-communicable diseases tend to be in the older elderly population. So these persons in particular, we would like to encourage them, yes, enjoy the festive season, and have your food, line with your family, but remember to take your medication. And for those a little older who need a little more care, their caregivers need to pay a little more attention to ensure that they're not missing their dosages of taking their medication as prescribed.
Now, you're giving us some actual things we can put into place there, making sure the caregivers are paying more attention. But what about the additional or external facilities that are usually available to us throughout the year? During the Christmas time, our health centers, our doctors and nurses are available as well?
Yeah, so all facilities continue to function and provide services throughout the year, as you mentioned. And we just encourage over the holidays, the accident and emergencies, the hospitals are available to provide care 24/7. But again, we would like persons to stay healthy and avoid having any emergencies as best as possible. And especially those persons who are known to have chronic medical conditions, we would like them to, enjoy themselves, but take a little more care and, enjoy themselves in moderation.
Remind us of those chronic conditions, what that could look like.
Yes, so non-communicable diseases is a group of non-infectious conditions. So these are illnesses that cannot be passed from person to person. Most commonly, you'd be familiar with diabetes, hypertension or high blood pressure, asthma, cancer, and also, cardiovascular diseases like heart attacks and strokes. So I'm sure you would know at least one person who has diabetes or who has high blood pressure, and require medication to manage their conditions. So we would, encourage you to just be mindful of your health and enjoy the festive season.
Give us some practical tips that we can employ when managing those non-communicable diseases.
Yes, so to start simply, the Ministry of Health, through its TT Moves campaign, continues to remind and encourage members of the population with our 4 key messages. 1, to increase your intake of water, increase your consumption of fruits and vegetables, and to move more. And we are encouraging persons to get familiar with their numbers, to get to know your numbers. So for those who are not already diagnosed, have your annual checkups. If you haven't as yet, now's a good time to do so and get familiar with what your blood pressure reading is like, what your blood sugar reading is like, what your cholesterol readings look like. Also, for those within the at-risk categories, to have your cancer screening test done as well, pap smears, mammograms, and the like. For persons who are already diagnosed with conditions such as diabetes and hypertension, making healthy food choices and, staying active and trying to avoid a sedentary lifestyle is also key. But for those who have diabetes and hypertension and require medication to keep those numbers under control, you don't take a break from it during the holidays. It's not a holiday from your medication. You require the medication on a daily basis as prescribed to keep your numbers in check. So to keep your blood pressures within a safe range, and so too with your blood sugars.
So that seems straightforward enough, but we have heard conversations of access to medications, for example, being a challenge for a number of persons throughout the year. During the holiday, is there anything particularly enhanced towards that end, or have we seen, as you see, the rise happens in January, but have we seen persons continuing to come in during the holiday season to make sure that they're topped up on their dosages, or do we see that lapse there specifically?
Well, actually, like I mentioned, the services are available,
right,
but we do see persons missing their clinic appointments. So we do have within our local healthcare system chronic disease clinics in primary care. So persons are given appointments to come if it's a 3-month check or 4-month check, to be seen and reviewed by their physician and to have their prescriptions refilled or updated. And we tend to see persons getting caught up in the festivities, prioritizing Christmas shopping as opposed to coming to keep their clinic appointment. And then you may have a scenario where they're due to come and have a revisit and have their prescription rewritten so that they can have medication. And missing this appointment, as you can imagine, they will not have a new prescription. And so we encourage you to keep your clinic appointments. We do see a drop-off towards the end of the year, and we do see less persons keeping those appointments.
We're giving trouble. Now, you did mention, eating healthier and increasing that intake of vegetables and fruit being a prime example. But the Christmas menu doesn't always allow for that.
Correct.
Do we also see any sort of change in terms of dietary suggestions being enhanced with those clinical visits, perhaps? Just so that we could find a nice midpoint. Maybe give us the portions of ham that we could have versus not having ham at all?
Well, we don't want to be too restrictive as well. We do want persons to enjoy themselves. So the message is not to cut out. It's everything in moderation, right? So you can have a little piece of black cake. Don't have a whole black cake, You can have a small glass of your punch creme, but please don't have a bottle or a few bottles of punch creme. Therein lies the problem, So we are asking you to eat and drink in moderation.
Fair.
As we're not telling you to not have and to cut out.
That's fair. I mean, to some extent, because sometimes that's a challenge to have a bottle of punch creme. But I definitely hear what you're saying in the sense of, I'm glad to hear rather that it's not an entirely different type of Christmas. You get to partake of the things that make it ours.
I mean, we can challenge you if you're creative in the kitchen to come up with healthier versions of our traditional local recipes. It would be nice to see, and to share it with neighbors and friends so that we can encourage these new healthier options. But just in case it may not come out as tasty as your traditional one, have it, but in moderation.
Let me say a special good morning to our nutritionist who joined us, telling us about adding vegetables to the black cake instead of fruit. Good morning to you, and tell us how it turned out. But for now, I'm glad that it is simply a matter of moderation rather than removing altogether. Any other actions that we want to consider when managing those NCDs, though? So we're sticking to the actual routine, visiting our clinics, we're adjusting and making sure everything in moderation. What else do we need to check on?
Well, your annual check is one. Compliance with your healthy lifestyle practices. So for those who have habits such as, cigarette smoking and excessive alcohol consumption, we would continue to encourage you to pick a quit date and work towards smoking cessation and to continue to limit your consumption of alcohol. That's another. And to comply with your physician's instructions. That's also an issue. Non-compliance is another major issue that we can face at times with persons wanting to do their own thing, especially with taking their medications and not taking it as prescribed. So in Trinidad, we have a culture where, I know my blood pressure is high because I have a pain in the back of my neck. So hypertension is a condition that has no symptoms. granted, the challenge that we face as physicians is to encourage you to take medication for something you can't see or feel, especially when you feel fine. But we have to look at the numbers, and if your numbers are elevated and within range for us to prescribe medication for you, we do encourage you to take your medication as prescribed to keep your blood pressures within a safe range. We're trying to prevent those heart attacks and strokes.
I'm feeling fine, so I wouldn't take it today, basically, is the notion.
Correct.
I have experienced that. Good morning, Mommy. But in terms of us as family members, as friends, as the caretakers, as you mentioned, how can we support persons managing their NCDs?
So that's an interesting topic, and the thing is, it's not about the person in the household who has a non-communicable disease. It's an everybody thing, because a healthy lifestyle involves everybody. So those who are diagnosed know of their status. Those who do not already have diabetes or hypertension are at risk. So we encourage everyone in the household to make healthy food choices and to increase their levels of physical activity and consumption of water, and to incorporate healthy lifestyle practices. So basically, for Christmas, there shouldn't be one set of food for the person in the house with diabetes or for the person who have pressure, right? The food should be healthy so that everybody could share in the pot. If I had to advise, that would be a key message.
And I can take that. I can take that. As it says from the ministry's message, celebrate responsibly and take care of your health. That's for everybody.
Yes. Everybody can exercise together and go for a walk.
I don't know what that part, but I do appreciate that you've given us some really useful information. And of course, we know we have the ministry's support through the clinics, through the regular visits, through the reminders to take our medication as it is recommended, and enjoy the holiday season in real true way without compromising our health. So we appreciate that tremendously. Any other messages you want to leave with us, Dr. Clapperton?
Well, we also have the support of the NCD hotline, 800-4NCD. So persons over the holiday season, this facility or hotline number is available 24/7. So in the event that your health center, it's outside of their regular business hours, and you do have a concern about maybe your blood pressure reading, etc., feel free to call the hotline for assistance. So we do have another medium to provide support for you this holiday season.
Perfection. On that note, we say thank you very much for sharing that. A very important message for us this morning, and making sure that those of us with NCDs can enjoy a very Merry Christmas.
Yes. Thank you.
Of course, Dr. Maria Clapperton, the Director of the Non-Communicable Diseases Unit at the Ministry of Health, joining us and giving us tips on how we can manage our NCDs this season. We've got more for you in the Christmas spirit of things, so stick around. The Now will return after these messages.